happy that MSN could organize this meeting. I could hear the speeches of various speakers, and all of you has covered very important challenges which you are going to face with the NEXT. I could also hear from Dr. Hariharan the comparative study with the NEXT and the international exams, and it's good in a way. This is a fear which we were always having, that when the NEXT was introduced, that Indian Medical Association per se, that we were opposing this, because this is a one step which is going to impart a very, very difficult situation for the postgraduate entry into the postgraduation for the students. Because India is a multidisciplinary, multicultural diversity, and from the urban to rural, a lot of difference is there in the different medical colleges. Though we have nearly 1 lakh students are appearing, invariably the amount of training, the amount of way in which they are getting the experience are different. But for all of them, making one examination to grade them or pass them and making them to eligibility to entrance, also in the same way, it is going to be a big challenge and big difficulty. But nevertheless, because now it has been introduced and it has to come, and the students has to take extraordinary steps and extraordinary care, both the faculty also, to make sure that you are able to ease out the problem. So a few challenges we have, because now it is now in the public domain, and so that we are expected to give our report, and the Indian Medical Association is also collecting data and giving our report. One of the most important thing, the first thing is what we note, there is no clarity on that who is going to conduct this examination. And this is a big dilemma, and because so far there's various exams are conducted by the national board. Now NMC is not interested to hand over this examination conducting authority to the national board, and they are now trying to establish their own body, or they are trying to give to some of the institutions like AIIMS. So when people of the caliber of the AIIMS or something is going to take the examination, that exam pattern is going to be very tough, very difficult for an average doctor to face. So that is a big challenge now we are having, that who is going to conduct the examination unless it is being streamlined, and we will not be able to do. And when this examination, who will be subject to the examination is still becoming a difficulty, because we are not sure whether it is going to be applied for the 2018 or the 2019 or 2020 batch. But Indian Medical Association, now what we are applied, we are recommending that it shall be possible only after 2021 batch, because when the 2021 batch students are joining, the curriculum was set and the pattern was given, the way in which the examination schedule with the finalized exam in combination with the part 1, part 2. So all that has been set. So they are focused. So when you are joining, when you are not sure that how your examination pattern, you cannot have that. So this is our demand, that at least this NEXT shall not be applicable to 2018, 19 and 20 batch. I'm sure that it cannot be for the 2018 batch, because they are now about to write the examination in the February. So they will not be able to do that. And the government has given a opportunity in the act itself, that they say if the phasing out of NEET, it is not an abrupt stopping of the NEET, it is only a phasing out. The government can have a plan to have the NEET as long as it is going to be has a value. So this class of the act that MSN and the JDN and the IMA should use very strongly to see to that it should be applied to the people who are entering at least by the 2021 batch, and where the syllabus is there. The third, that's one of the dangerous class which has been incorporated, is this exam is not only for the BBS students of India and the students who are coming from abroad. A class is being included whatever the degree which the government feel can be incorporated into the medical section, they will be also allowed to write this examination. That is a quite dangerous thing, which is it is in reading it along with the National Health Education Policy or the government policy of the mixopathy. In the future, the government may try to introduce and incorporate this into NEXT 1 or NEXT 2 can be incorporated to make sure that Ayush people are also now getting to come into the system. So that is again going to be a big challenge, that we need to be extremely cautious on that and fight out this. One of the big challenge what I feel is the exam pattern of the NEET NEXT 1 and 2, which they say the supplementary exam and the next exam will be after a year. So by chance, you get into some sickness of taking to take a leave of 2 months or leave of 3 months, or if you are getting into a problem, you met with an accident and you having a fractured your leg or fractured your hand, you may not be able to come for the college for the 2 months. then your opportunity for sitting in the examination is going to come only after a year. That means you are going to lose almost 9 to 8 months unnecessarily just because that. When they are saying that this examination, when Hariharan was saying that this examination is at par with the USMLE, USMLE is not conducted once in a year. It is conducted even normally, basically 2 times or 3 times they are able to conduct the examination. So unless this examination pattern, when they are going to give the gap of 1 year, that is going to be a big challenge. Similarly, it is for the next 2 also. Even the house urgency, when you are doing, there is a now the system is there. A student, before he finishes the internship, he can go abroad, have a training for 3 months, 4 months, or observership, come back, and he can finish the examination, finish the internship. But it is not possible now, because you are going to take 2 months leave, then you are going to sit for another 1 year to face your next 2 examination. So this class is a very dangerous class unless that you are going to make the examination periodically at minimum once in 6 months or minimum once in 3-4 months. We are at least the part 2 examination. If it is not going to help, this is going to hamper many students, and many students will be face a problem, because then it also has the private medical colleges can play on that, because now there's some certain private medical colleges are very strict on the attendance, and they are going to charge exorbitantly for clearing the attendance. I know that some of the universities are also playing a role. If you have a 10% attendance lack, then you have to pay so much of money to clear that. So similarly, if you are going to have the examination for the waiting for another 8 months or 9 months, and then naturally it is a very difficult center. The another issue which we find it difficulty is that is next 1 and 2 is going to be conducted in a center where the government feel it is appropriate. So it is not going to be happen in your college. It is not going to happen in an institution. Maybe it is going to happen in another place, and how that place is going to be chosen, how that place is going to be open, when you are going to be in a different situation, how it is going to be impact. This also again becoming a big problem. It is going to happen. Most importantly, what I feel that is one of the going to be the worriest problem for me. The government, they say that they are going to make the examinations, the questions are going to be the basic questions. That's a must-know question, 60%, and the rest from the 20% extra, and the nice to know, and at what we are going to do. But who is going to decide which is the need to know? So far, it is institution-based or the university-based. Within a university can decide which is the need for. For example, if you take hernia, and if I take on, if you know only the anatomy and the surgery by name, that is a must know. And if you try to know lab surgery is as a need to know or nice to know. But that same is not true with an AIIMS. It is not true with an higher institution. It is not same with Madras Medical College and Kanyakumari Medical College, where the faculty thinks or the one university thinks as a must know may not be the true for the must know for another university in abroad. And I have seen certain universities of the private universities, they are even giving the questions earlier and say this is kind of question we are going to take, and this will be the need to know and must know. And that classification clarity, who is going to decide? Is it is going to be the NMC is going to come out with that this is the must know chapters, these are the need to know or nice to know chapters, and that clarity is not there. It is being decided by the universities. Now when it is going to be taken in an all India panel and going to impress upon the rural student, impress upon the students who are going come from the a college which is not having updated, this is going to impact the students from getting into the major issue of facing that. What you may think that it is not a must know, the examiner or the person who is going to set may think that it is a must know, and he may ask the question. So that clarity of that examination pattern is not going to be there. And more so, that many speakers has already explained about the problem we are going to face with an MCQ, the problems which we are going to face with it. Nowhere, even if the USMLE or any examination you say, it is not going to be depend only upon an MCQ. No one can get an admission in a PG institution after your the two months of the fundamental course in the UK or US. You cannot get into the PG just because you score high marks in an MCQ based question. So there are so many other factors playing. But unfortunately in India, So it is purely on your MCQ question. It is not going to be any other factor and any other way that you have contributed is not going to be up there, especially whether you have done a research, whether you are done involved in any publication, when you are involved in any of the extraordinary skill work which you have done, all that is not going to count it. So it is going to be a mere your examination pattern MCQ. So in no way that it can be connected with any other international examination where it is purely based on the MCQ. So still it is going to make you much difficult to get into the admission into the postgraduate state. The most crucial issue comes that you are passing and someone is saying that you are eligible to get into the postgraduate examination. And unfortunately, if you get into your university, you have a problem with your own HOD, you have a problem with your own person. And if that college is thinking that I will not make him to pass the university examination, and then what is the fate of you? Even if you are one person is going to score highest mark and making it eligible to get into the PG, and if he is not able to pass the university examination, which is going to be conducted separately, exclusively in the college with the old pattern of the examination pattern, and then it is going to be a disaster for the student. The dichotomy, the personal ego, the personal egotic class, and the various ifs and buts which is placing in that examinations are going to be of a big challenge for the students to face. So how he is going to concentrate for the practical exam and theory exam in a totally a different setup, and how he is going to get into this is a big problem. And the certification, who is going to give a certificate, is not being explained by as per the UGC Act. It has to be only the university has to write to give the degree certificate. But now here, someone is writing your theory examination, conducting the theory examination. It is not yet decided. So somebody will be conducting theory examination, taking that as a pass mark for the theory. Now university has to give a certificate, give a pass degree certificate. But that is quite unfair for a university, because the only purpose of the university is to screen you and take into your consideration. So that is going to be again a big debate unless this act is going to modify the UGC Act, modify the Degree Act of India, and it is again going to make a big problem, and it is again the students are going to face a major issues of that. And many teachers, including Gita Lakshmi, was telling that the faculty has to be trained, faculty has to be done. Yes, it is. All needs time. All needs, it cannot be done on all of a sudden. You introduce, do the examination, then go for a faculty training. It is not possible for that. So the government should take its own time, and if there is no, the steps should be clear, the hurdles should be cleared, and they should do adequate faculty training, adequate faculty orientation, adequate the classification of the subject, adequate way of giving the students that when the examinations are going to happen. If it is not being done, and then there will be a lot of the mafias, people like there's the coaching centers coming into the play, various agencies coming into play for the coaching will also come. So that's all it putting the students into a difficult situation. So I assure on the of Indian Medical Association, we will try our level best, taking into the input of all of you to ensure and lobby with the government to make them understand the difficulty and make sure that PG this next is not abruptly replacing it as in their own time as they have put. It will be phased out in a slow manner. It will be applied to only the people from 2021. It will be come out with adequate faculty training and faculty orientation has been taken place, and adequate way of examination system is brought out. Then only this next will be allowed. But if it is earlier, it is put in, if it is coming just like that, it is going to be a disaster for the medical college and medical students, because you are always going to be in a tender hook, and even one day, if you are going to take a leave for 2 days, 3 days, 4 days, or if you are unfortunately get into sick, then you will be getting into the problem. So these difficulties we understand, we realize the situation. We want MSN and JDN to be a little more active, proactive, write again and again, bring it in the public, bring it to the newspapers, bring it to the knowledge of the NMC in your own style. So your own social media, your own work should be highlighting these issues, then only you will be able to do. I must thank Dr. Sambat Kumar sir for well explaining how it is going to impact on the medical legal system, how it is going to affect that system also. So in general, though it is a step thinking in terms of UK style or US style, but before that, they should clear the level fielding play level. In India, they should systematize that, regularize it, promulgate the proper rules and regulation, then only the NEXT should be all. So till then, IMA will also will oppose this, and with all your support, that at least we will get some modification which is shooting to the students, to benefiting the students to get into the proper education and get into the good doctors in the society in the days to come. Thank you very much for your organizing this meeting. I only wish and hope MSN will be sensitized, MSN will take up in a big way, and you will be fighting hard to ensure that we are getting some positive results in the act which has been pronounced.
Thank you so much, sir. Thank you so much for the highly informative speech, sir. Meanwhile, I would like to welcome Dr. Ajay Saha, Chairman, IMA JD in Maharashtra. If the dignitaries have any questions right now or any doubts from the audience, please feel free to discuss with us speakers currently.